Cataract does not begin when a person has almost stopped seeing. It begins much earlier, at the moment when the familiar picture becomes as if dimmer, blurrier, less vivid. But this change happens so gradually that it is easy to blame it on fatigue, age, new glasses or poor lighting. And that is exactly why cataract so often turns out to be not a sudden problem, but a condition a person gets used to, without even noticing how much their vision has already changed. A great many people imagine cataract incorrectly. Some think it is a film on the eye. Some are sure it is something on the outside that can be removed with drops. Some say, my vision has simply become worse with age. In reality, cataract is a clouding of the lens. The lens is located inside the eye and normally should be transparent. It is through it that light passes farther to the retina so that we can see clearly. When the lens loses its transparency, the image stops being clear. Light passes worse, scatters incorrectly, and the person begins to see as if through fogged glass. The most important thing here is to understand that cataract does not always feel like a sudden drop in vision. More often, everything happens gently and gradually. At first, a person feels that the eyes have started getting tired more quickly. Then they notice that bright light becomes uncomfortable. Then they catch themselves thinking that reading has become more difficult, especially in evening lighting. Then there is a feeling that people's faces have become less clear, colors less contrasty, and the usual glasses no longer give the clarity they used to. And at some point the person says, I don't understand. I even changed my glasses, but it didn't get better. This is a very typical situation for cataract. People are often surprised when they hear that cataract is not rare and not something unusual. On the contrary, it is one of the most common age-related changes of the eye. With age, the tissues of the lens gradually change and it begins to lose its transparency. This is a natural process, but that does not mean nothing needs to be done about it. Age is not a diagnosis. Age explains why the problem may arise, but it does not cancel the need to understand how much it is already affecting vision and what to do next. At the same time, one should not think that cataract occurs only in elderly people. Yes, most often it develops with age, but there are other causes too. The condition of the lens can be affected by injuries, diabetes mellitus, some inflammatory eye diseases, long-term use of hormonal medications, ultraviolet exposure, and sometimes congenital features. That is why the very approach of "this is only an old age problem, it does not concern me yet" is not always correct. Eyes do not like superficial conclusions. Sometimes a person comes to the appointment complaining of worsening vision and is sure they simply need new glasses, but the examination shows that the cause is something completely different. There is one very characteristic misconception. Many people think that cataract обязательно means a white pupil that can be seen with the naked eye. That really can happen at very advanced stages, but much more often, cataract is present long before such external signs appear. And that is exactly the problem. When a person waits for the disease to become obvious by itself, they lose time. Not because one must rush at any cost, but because it is much easier to make calm, balanced decisions when the condition of the eye has been thoroughly assessed and it is clear exactly how cataract is affecting vision now. Cataract can manifest in different ways. For one person, the main issue is haziness of the image. For another, sensitivity to light. For a third, problems with driving at dusk or at night. Very many patients begin complaining of halos around headlights, streetlights and bright lamps. Light seems to glare more strongly than usual. The contours of objects lose clarity. Some notice that they have started seeing worse in contrasting lighting, for example when going indoors from a bright street, or vice versa. It also happens that a person suddenly notices a strange improvement in near vision and is happy that they have started using reading glasses less. But sometimes this is not a sign of improvement, but one of the changes the lens produces in cataract. That is exactly why cataract often misleads people. It can not only worsen vision, but also change its character, so that the person begins to think the problem is unstable or related to glasses. Today better, tomorrow worse. One effect in bright light, another in the evening. Because of this, a false feeling appears that the situation can be solved by choosing different lenses or simply waiting it out for a while. But cataract is not a matter of fatigue that passes after sleep. It is a change in the transparency of the lens, and it does not reverse on its own. From this comes one of the most common questions. Can cataract be cured with drops, tablets, vitamins or exercises? And here it is important to speak calmly and honestly. If the lens has already become cloudy, it is impossible to make it transparent again with conservative means. As of today, cataract treatment is the surgical replacement of the cloudy lens with an artificial intraocular lens. Sometimes it is difficult for people to accept this because the word operation itself causes anxiety. But in reality, what matters here is not to be frightened by the wording, but to understand the essence. This is not about cutting the eye for an experiment, but about a clear, long-used method whose goal is to restore the transparency of the optical system of the eye. At the same time, there is another old idea that still prevents people from seeking help in time. Some are sure that the cataract must ripen, and only then can something be done. This phrase passes from generation to generation, although the modern approach has long been different. Today, we do not aim to wait for the latest possible stage. We look at how much the cataract affects a person's quality of life. If it already interferes with reading, working, recognizing faces, driving safely, or moving normally in a familiar environment, then the question of treatment becomes practical rather than theoretical. There is no need to let the situation get to the point where vision falls so much that a person literally starts dropping out of their usual life. It is also very important that cataract is not only about numbers in the doctor's office. Sometimes visual acuity at one examination still looks relatively good, but the person is already suffering greatly in real life. For example, during the day they see more or less tolerably, but in the evening they cannot confidently cross the road. Or they can read large text but cannot tolerate bright light sources. Or they recognize people up close but cannot see facial expressions at a normal distance. That is why the decision about treatment is always connected not only with measurements, but also with how exactly you live, work, move, and how much vision limits your usual actions. What happens during the operation? To explain simply, the cloudy lens is removed and a transparent artificial lens is placed in its place. This lens is called intraocular. It remains inside the eye and takes over the optical function of the natural lens. For the patient, it is especially important to understand that the goal of the operation is not simply to remove something, but to restore the passage of light and improve the quality of vision. Of course, the tactics and the prognosis depend on the overall condition of the eye, on the retina, the optic nerve, and accompanying diseases. But the logic of treatment itself is exactly this. A full examination is always needed before the operation. And this is exactly where many people make a mistake, thinking that if the diagnosis is already clear, everything after that is simple. In reality, preparation is of great importance. The doctor evaluates not only the degree of cataract, but also the cornea, retina, intraocular pressure, the length of the eye, anatomical features, and the presence of accompanying problems. This is needed not to complicate the process, but for accuracy, especially when it comes to calculating the artificial lens. It is important for the patient that after treatment, it should not simply become brighter, but that vision should be of the highest possible quality and correspond to the capabilities of the eye. Many fears are associated with cataract. One of them is the fear of the operation itself. People imagine something difficult, long, painful, and frightening. But anxiety is most often built not on reality, but on lack of knowledge. When a person receives a calm, understandable explanation, it becomes much easier for them. They understand that modern ophthalmology is precision, planning, and a very clear sequence of actions. Yes, any medical intervention requires responsibility and individual assessment. But the fewer myths and random frightening stories there are in the mind, the more calmly the decision is made. There is also the opposite extreme, excessive lightness. Sometimes a person says, "Cataract is nothing, they will just quickly replace everything for me." This approach is not entirely correct either. Cataract is indeed treated effectively, but eyes do not tolerate a superficial attitude. It is necessary to assess the condition of the whole eye, choose the right moment, go through the examination properly, and follow the recommendations after treatment. In medicine, good results usually appear not because of carelessness, but because of consistency. That is exactly why it is important not to underestimate the problem, but also not to dramatize it. It should be said separately that cataract does not go away by itself. It does not dissolve, does not clear up, and does not disappear from folk methods. Sometimes a person postpones the visit for months and even years because they are looking for an easier way. They want to believe that there are drops that will return transparency to the lens, or a home recipe that will avoid an examination. This desire is understandable. No one wants to hear about surgery. But honest medicine begins where a person is not promised the impossible. If the problem is in the cloudy lens, then it is exactly this problem that must be solved, not time spent on things that do not change the essence. At the same time, it is important to remember, not every decrease in vision in an older person is automatically cataract. Sometimes cataract really is present, but it is not the main cause of the complaints. Sometimes, along with it, there are retinal changes, glaucoma, diabetic retinopathy, or other conditions. That is why self-diagnosis is especially dangerous here. A person may say, "I definitely have cataract, everyone at my age has it," while in reality missing another problem that is no less significant. That is exactly why examination is so important. It helps not to guess, but to see the real picture. When should you go for a checkup? At the moment when you notice that vision has become dim, blurry, less contrasty. When glasses no longer give the needed sharpness. When the light of headlights, lamps, or the sun has started to irritate you more than before. When reading has become tiring and evening vision less confident. When you feel as though you are looking through a light haze. This is not a reason for panic. It is a reason to calmly have an examination and understand whether there is cataract, how pronounced it is, and how best to proceed next. And one more important point. Very often a person gets used to seeing worse than they could, especially if the changes were gradual. They adapt, hold the phone closer, choose brighter places, stop driving in the evening, avoid small text, rebuild daily life around worsening vision, and do not themselves notice how much their possibilities have narrowed. That is why talking about cataract is not only about the disease, but also about quality of life. About the possibility of seeing loved ones' faces clearly, reading without constant strain, feeling more confident outside, not depending on favorable lighting, and not getting tired from ordinary visual tasks. A calm attitude toward cataract is not indifference. It is the understanding that the problem should neither be exaggerated nor ignored. It must be assessed correctly. Do not wait for extremes. Do not test internet advice on yourself. Do not calm yourself with only one thought. It is just age. Age-related changes can indeed be natural, but that does not mean nothing can be done with them. Modern ophthalmology helps a person not to put up with worsening vision only because it seems to them that this is simply how it should be. It is also very important that a timely decision allows the whole path to be calmer. When a person seeks help not at the moment when they already see almost nothing, but when they are only beginning to notice real changes, they have time for examination, for questions, for understanding the situation, and for a balanced choice. This is always better than postponing for a long time, enduring inconvenience, and then acting against a background of fatigue, irritation, and anxiety. Eyes deserve not last-minute haste, but attentive care in advance. Cataract is a story not about hopelessness, but about clarity, both literally and figuratively. When a person understands what is happening to them, they stop being afraid of empty horror stories and begin to make decisions calmly. They know why vision has become cloudy. They know why glasses no longer help as before. They know why drops do not return transparency to the lens. And they know what to do next in order to see the world more clearly and confidently again. If you notice that your vision has become dimmer and less clear, if bright light has started to bother you and your usual glasses no longer give the needed result, do not postpone a checkup. Have an examination at Ko'z Nuri Eye Clinic to understand exactly whether this is related to cataract and which solution will be right specifically for you. Calmly, without pressure, without unnecessary promises, with a clear explanation and careful attention to how you see today and how you want to see further.